Bedwetting, or nocturnal enuresis, is when a child unintentionally urinates while sleeping, usually at night. This typically happens after an age when bladder control should typically be established, but the child continues to have accidents while sleeping. The condition is actually quite common, affecting about 15% of 5-year-olds and gradually becoming less prevalent as children grow older. Most kids naturally outgrow bedwetting, but it can be frustrating for both the child and the parents. For most families, bedwetting creates practical challenges with laundry and sleep disruptions, but the emotional impact on a child's self-esteem can sometimes be the bigger concern if not handled with sensitivity and understanding. Bedwetting can be divided into two main types: primary and secondary. Primary bedwetting means the child has never had a long period of staying dry at night. This means that these children haven't yet developed the ability to stay dry through the night. On the other hand, secondary bedwetting occurs when a child who has previously been dry at night for at least 6 months begins wetting the bed again. Causes of bedwetting in children. Bedwetting can happen for several reasons, and often it's not just a single cause, but a combination of factors. One of the most common causes is simply delayed development of bladder control. Some children's bodies take longer to develop the ability to hold urine overnight or to recognize bladder fullness during sleep. This developmental delay often runs in families, so if you or your partner wet the bed as children, your child might be more likely to experience it too. Another significant factor is the production of antidiuretic hormone, which normally increases at night to reduce urine production while sleeping. Some children produce less of this hormone, resulting in more urine production overnight than their bladder can comfortably hold. Sleep patterns also play an important role in bedwetting. Some children are such deep sleepers that they don't wake up when their bladder signals that it's full. Their brain simply doesn't register the message from the bladder during deep sleep stages. Other than these causes, stress and emotional changes can also trigger bedwetting, especially in secondary cases. Big life events like starting school, moving to a new home, or the arrival of a new sibling can create anxiety that may manifest as nighttime accidents. Physical causes shouldn't be overlooked either. Urinary tract infections can irritate the bladder, making it harder to hold urine overnight. Constipation can press on the bladder, reducing its capacity. Less commonly, structural problems with the urinary tract, neurological issues affecting bladder control, or conditions like diabetes that increase urine production might be responsible. Symptoms of bedwetting in children. The most obvious sign is, of course, waking up with wet pajamas and sheets, but there are other symptoms that might accompany bedwetting or indicate an underlying problem. Some children may experience daytime symptoms as well, such as urgent or frequent urination, straining or pain during urination, or small accidents during the day. These could signal a medical issue that needs attention. You might also notice your child drinking excessive amounts of fluid, particularly in the evening, which can contribute to nighttime wetting. Behavioral signs are important to watch for too. Children with bedwetting often develop specific emotional responses like embarrassment, shame, or anxiety about sleepovers or overnight camps. They might become secretive about their bedwetting, hiding wet sheets or underwear, or showing reluctance to discuss the issue. Some children may even develop sleep avoidance behaviors because they're anxious about wetting the bed. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Is bedwetting a symptom of an underlying medical condition? While most cases of bedwetting are simply due to delayed development of bladder control, sometimes it can signal an underlying medical issue that needs attention. This is particularly true for secondary bedwetting, where a previously dry child starts wetting the bed again. Potential medical causes include urinary tract infections, diabetes, sleep apnea, constipation pressing on the bladder, or rarely, structural problems with the urinary tract. So, if the bedwetting is accompanied by symptoms like painful urination, unusual thirst, daytime accidents, changes in urine color or smell, or if it starts suddenly after a period of dryness, it's important to consult a doctor. They can perform simple tests to rule out these conditions and provide appropriate treatment if a medical cause is found. Diagnosis of bedwetting in children. When bedwetting becomes a concern, doctors will typically start with a thorough medical history. They'll want to know when the bedwetting started, how frequently it occurs, any daytime symptoms, family history of bedwetting, the child's fluid intake patterns, and any stressful life events that might have triggered the issue. A physical examination comes next, focusing on the abdomen, genitals, spine, and neurological functions related to bladder control. The doctor will check for signs of infection, constipation, or structural abnormalities that might contribute to the problem. Urinalysis is usually performed to rule out urinary tract infections, diabetes, or kidney problems. The doctor will examine a sample of the child's urine for signs of infection, unusual protein or glucose levels, or other abnormalities. For most children, no elaborate testing is required unless there are additional concerning symptoms like pain, blood in the urine, or sudden weight loss. Treatment for bedwetting in children. Number 1. Behavioral changes. These are typically the first-line treatment for most children with bedwetting. Establishing good bathroom habits is essential here. This includes encouraging regular bathroom visits throughout the day and always using the toilet right before bed to ensure that their bladder is as empty as possible before sleeping. Limiting fluid intake in the hours before bedwetting is also helpful, however. It's important to ensure the child stays well hydrated during the day. Some families find that waking the child to use the bathroom before the parents go to bed, often called lifting, helps keep the bed dry, though this doesn't teach the child's body to wake up on its own when the bladder is full. Number 2. Moisture alarms. These devices are considered one of the most effective long-term treatments for bedwetting, with success rates of 60 to 80% when used consistently. A moisture alarm consists of a sensor attached to the child's underwear or a pad placed on the bed. When the sensor detects the first drops of urine, it triggers an alarm designed to wake the child, who then completes urination in the bathroom. Over time, this conditions the brain to either wake up when the bladder is full or to hold urine during sleep. It typically takes 3 to 4 months of consistent use to see results, and parents often need to help wake the child initially until the conditioning takes effect. Relapse can occur in about 20 to 30% of cases, but reusing the alarm usually brings quick improvement. Number 3. Medications. For temporary situations like sleepovers or camps, or when other methods haven't worked, medication may be prescribed. Desmopressin is the most commonly used medication, which works by reducing urine production at night. It's available as a tablet or nasal spray and can be very effective for short-term management, though bedwetting often returns when the medication is stopped. For children whose bedwetting is related to small bladder capacity or overactive bladder muscles, anticholinergic medications like oxybutynin might be prescribed to relax the bladder and increase its capacity. These medications can have side effects like dry mouth, constipation, or facial flushing, so they're typically used only when necessary and under careful medical supervision. Number 4. Psychotherapy. If bedwetting appears to be related to emotional stress or psychological factors, especially in cases of secondary bedwetting, counseling or therapy might be recommended. A mental health professional can help the child develop coping strategies for stress and anxiety while addressing any underlying psychological issues contributing to the bedwetting. Family therapy might also be helpful if family dynamics or parental approaches to the bedwetting are creating additional stress for the child. Number 5. Managing constipation. If constipation is a factor in a child's bedwetting, addressing it directly can improve nighttime dryness. This might involve increasing fiber intake, encouraging regular bathroom breaks, and using stool softeners if recommended by a doctor. Relieving the pressure that a full bowel places on the bladder can often reduce bedwetting episodes. At the end, remember that patience and emotional support are crucial elements of any treatment plan. With the right approach and understanding, most children overcome bedwetting and develop healthy bladder control as they grow. Now, we want to hear from you. Has your child ever struggled with bedwetting? What strategies or treatments have worked best for your family? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.